Hello, everyone, and a big thank you for joining tonight for Expanding Your Impact Through Advocacy. The Association of Black Cardiologists has very lofty but attainable goals. We want to reduce cardiovascular disease and eliminate systemic barriers to health that many of us face. Advocacy, in all of its forms, is essential to achieving these goals. Our community health advocate coordinators are our points of contact with the community and are critical for our network of heart health community education. This is the front line of our advocacy. Today, we're going to learn how all of us can use our skills as community educators and organizers to help impact government health policies to protect our health and improve our survival. The reality is that we need strong partnerships with various government entities to achieve our goals. We need Congress to write and pass laws, and we need government agencies to implement policies that will help our communities. We must hold our legislators accountable. It's very important, and we really do appreciate you taking this Juneteenth weekend time to spend this with us, because as part of our advocacy, it goes on with the message of Juneteenth in terms of what we can do to protect ourselves from some of these systemic inequities that have been placed upon us. And we know that our voice has power through advocacy to influence the creation and implementation of favorable policies that will actually protect our health and to promote our survival. During today's training session, you will learn why our voice matters and how to effectively influence the decisions that are being made by policymakers that impact our community's ability to keep us heart healthy. We will hear from Megan Gordon-Don from NGD Strategies, who will share some secrets of success when it comes to advocacy and how you can make sure that your voice is heard when it comes to influencing public policy. We'll also hear from our policy consultant, Camille Bonta from Summit Healthcare Consulting, who will share timely information on policy issues that the Association of Black Cardiologists feels that we should all be concerned with, and how we can benefit from our combined grassroots advocacy. We'll also hear from my esteemed colleague, Dr. Daphne Ferdinand, who co-chairs ABC's Community Programs Committee. First, just a quick housekeeping note. Please post all of your questions to the Q&A, and then certainly use the chat for any comments that you have that are not directly related to questions and answers from the panelists. And at this time, I would like to introduce you to Megan Gordon-Don from NGD Strategies, who will perform the rest of the program. Thank you.
Thank you, Dr. Underwood, and welcome to everyone. This is so exciting to have all of you together and to be talking about advocacy and how we can really take all that we do and bring it to the next level to have a true impact and an even greater impact on improving our health. So to start, I wanted to ask if everyone could go to the chat, and if you see the chat at the bottom of your screen, and you can make sure you're directing your comments to everyone, and write what advocacy means to you. Does it mean that you tell your doctor what your healthcare needs are? Does it mean that you tell your mayor something, or just what does that word mean to you? And so if everyone could just take a few minutes and or take a minute and fill out what that means to you, that would be great. And we're gonna keep going while everyone does that. Hopefully, there you go. So if you haven't filled out what advocacy means to you yet, advocacy can mean a lot of different things. And sometimes we talk about it as advocacy with a little a and advocacy with a big A. So advocacy with a little a can mean talking to your doctor about what you need and making sure that your doctor understands what's going on with your health. It can be talking to your community about heart health and making sure that they understand all the steps that they can take to be heart healthy. So it can mean something that you're doing kind of either for yourself or for your community. Advocacy with a big A usually is talking about talking to some sort of elected officials. So either asking Congress to take action on a specific issue or asking a government agency to take some sort of specific action. And we're going to focus today on advocacy with a big A. That doesn't mean that advocacy with a little a isn't just as important. We just, as advocates, we want to make sure we're doing both types of advocacy. So advocacy is really the grease that leads to action. And if any of you remember how a bill becomes a law from the 1970s and growing up on Saturday mornings and watching that, advocacy really starts with community issues and it grows from there. But the reality is that there are so many different issues that are out there and so many different things that our elected officials hear about in any given day. But they have to hear about an issue or be educated about an issue to actually take action. So there are, I had the numbers and then lost them, but there are all of these Americans who could take action. And yet a very small percentage of Americans actually do it, actually take the steps to talk to their elected officials about specific issues. And the only way that policies really reflect what we need them to reflect is if we're talking to our members of Congress. So this is a constitutional right. Our Constitution gives us the right to petition the government for redress of grievances. It is something that we are entitled to as citizens, and yet very few people actually take the steps to do it. And so if we want to have policies that really give us what we need, then we all need to take responsibility for talking to our members of Congress and talking to our elected officials to make sure that they know what we need. So policies originate from specific problems that members of Congress hear about. So maybe they hear about that there are too many kids who are smoking, or we need more insurance coverage for cardiovascular disease prevention, or we need more park areas so that there are more places for us to walk and be outside and get exercise. And then what happens is that those policies get introduced as laws by a member of Congress. And there are over 10,000 laws that are introduced every year, or every congressional session. That's a 2-year session. But only 2% of those actually become law. So the ones that become law because they heard from a lot of people usually that that's an important issue that they need to take action on. So that's part of advocacy, is not only telling our elected officials what we want them to do, but then following up and making sure that they actually enact the policies that we want them to. And then once those policies are passed, after a bill is passed, then there's a whole separate process for how those new laws get implemented. So the first thing that happens is the Congress passes a new law. And then an agency tells the public that they're going to create what's called a rule for that. So maybe it's a new law that is going to create a new park or a new park system. And so the National Park Service will say, we're going to have a new rule about how these parks get used. And then they issue that proposed rule, and it may have all, this is how we as an agency are going to implement this new law. And then the public is given the opportunity to comment on that rule and say either that makes a lot of sense, or this isn't going to work for our community and this is why. we like this, we don't like this. And so that's another opportunity for us as citizens to influence the process and make sure that the laws that are being not only passed, but implemented really reflect what our communities need. Then the agency, after they get all the comments, they issue the final rule. And then those rules are published and they become part of how that agency moves forward. So regardless of whether you're talking to your elected officials about an idea or about a specific law that we want to get passed, or talking to an agency that is developing a new rule, there are certain rules and principles for how to be most effective. So we're going to talk through some of those just so you have kind of an overview of what that looks like and what that feels like. So first, no matter what you want to do, you have to know what your goal is. So what are you trying to accomplish? Whether you want your member of Congress to introduce a new law on the park system, or something to do with insurance coverage, or you want an agency to do something different. You need to know exactly what it is that you want to have happen. You want to understand who you're talking to. So talking to a member of Congress is very different than talking to your community or talking to an agency. And so how you talk to that individual or that entity really changes depending on who your audience is. In our government, it's really important that no matter who you talk to, you're showing that you're a constituent and you have some interest in the issue. And for those of you maybe who are lawyers or no lawyers, you may have heard the term standing. So that's another way to say interest. So if I live in Texas and I am talking about how this new law is going to implement me in Texas, then I probably doesn't make sense for me to write to Wyoming and talk about how they're going to implement the law in Wyoming. We always want to have a concise message. And so, there's always, you hear people talk about the KISS principle, keep it simple, stupid. I like to rethink that. And when we're talking about advocacy, you want to keep it stupid simple. So you want one message, you want it concise, you want to make sure that you are very clear on what that message is and what your goal is. And you need to stay on message. So if you have one goal and you go into a meeting or you're writing a letter and you start talking about things that don't necessarily have anything to do with that, your message is going to get lost. So you want to stay on that specific message that you are focused on for that interaction. It doesn't mean that that's your only chance to talk to your elected official, or you can write another letter to a regulatory agency, or to your member of Congress, or to your mayor. There are always other opportunities. But in order to get something done, you need to have one ask at a time and be focused on that. Don't use jargon. So if you are, and this, I always tell physicians this, if they are talking about a specific disease, or if you are talking about some issue that is complex, think about how you explain it to somebody who doesn't live and breathe these issues. So if you are talking to an elected official about how something impacts your community, you don't want to necessarily assume that they understand everything about your community. For example, if you use an abbreviation or some other word for you call the park something else down the street, you want to make sure that you're explaining, oh yeah, that's the park at Johnson and Main Street, and make sure that you're explaining what you're talking about. And one of the most important things is make it personal. It is so important in this day and age that we use authentic stories, our authentic stories, to talk about why these issues, why these laws are so important to us. In this age of digital everything, where it's become so easy to get lots of people to sign a petition or to move on something, showing that you have some sort of standing in the issue, explaining your personal reality and why this matters to you, why it matters to your community, is often the difference between getting something done and not. Those personal stories are what the members of Congress, what your elected officials will remember. I was a congressional staffer over 20 years ago, and I still remember some of the stories of our constituents that I heard from. I, to this day, can picture their faces and can hear their stories in my head about a whole range of issues. And it's those stories that really make things happen. And that is really the true brief of getting advocacy done in today's day and age. So no matter what type of advocacy action you have when you're talking about elected officials, you are the expert on your experience and in your field. You know your community better than anyone. You know this disease that we are trying to prevent. You know cardiovascular disease issues. You know what we're focused on for heart health. And you are the expert on your own personal story. So I know sometimes it can feel really intimidating to interact with elected officials, but you are the expert. And so remembering that and remembering that your elected officials want to hear from you because you are a constituent. And so they are looking for input on how these things are going to impact people back home. Follow-up is always the chariot of genius. I heard this long ago, and it is something that I tell my kids on a daily basis, and tell all the advocates that I train. It is so important when you have an issue that is important to you that you not just take one action, but you follow up. This advocacy is really about building relationships. And so when you take some action, if you just take one action one time on an issue, then that's a good step. It is showing that member of Congress or that regulatory agency that you're being counted, your voice is being counted there. But to really have a significant impact and to make sure that they are following through in the way that you need them to, you need to keep up that discussion. And that is true no matter at what level you're talking in the government, local, federal, everywhere in between. It is really important that you build up that relationship and that you follow up. So I'm going to turn it to my colleague, Camille Bonta, to talk a little bit about a specific issue that we're going to ask you to focus on to put some of these principles into practice. Camille is a true policy expert, and she is ABC's policy consultant. So she knows these issues better than a lot of people. So I'm going to turn it over to Camille.
Great. Thank you so much, Megan. As Megan said, I'm going to walk through a policy issue that the ABC cares a great deal about, and I suspect many of you will as well. And then when I'm done walking through the policy issue, Megan is going to show you the steps that you can take to be an advocate on this issue. This April, the Food and Drug Administration, which is one of the government agencies, issued a proposal that would eliminate menthol in cigarettes. And this is a historic and really a long overdue action by the FDA. For decades, the tobacco industry has targeted Black communities with marketing for menthol cigarettes. And the industry also uses these flavor products, these flavored cigarettes, to lure kids into a deadly addiction. And this rule would put an end to these predatory and really deadly practices. And I'm going to go over briefly what the proposal would do. So as I mentioned, the proposal would prohibit the use of menthol as a flavor in cigarettes and cigarette components and parts. This means that menthol couldn't be used to flavor the tobacco, the filter, the wrapper, or the paper. The prohibition would even cover menthol flavoring that is separate from the cigarette. So for example, menthol can be added to non-menthol cigarettes, like using liquid drops. And the FDA is saying in this proposal that this would be prohibited as well. The enforcement of this rule, if it's finalized, is directed at manufacturers and distributors, wholesalers, importers, and retailers. The proposal does not make it a crime for individual consumer possession or use of menthol cigarettes. However, the tobacco industry is going to pull out all the stops to fight these rules. And they will do that by pushing false claims that Black Americans will be subject to more law enforcement abuse. But the FDA has made crystal clear, and the ABC agrees, that this is simply not true. While we will focus our advocacy efforts on the proposal to eliminate menthol cigarettes, there is also a separate rule that would eliminate menthol and flavored cigars, which the ABC supports as well. Next slide, please. Now I want to go over why this proposal is so important and why it has the full weight of ABC support. First, this proposal would protect kids by reducing youth experimentation of cigarettes that can lead to addiction. Menthol is a very attractive feature to an inexperienced smoker because it produces a minty taste and a cooling sensation when it's inhaled. Menthol's flavor and its sensory effects reduce the harshness of cigarette smoking and make it easier for new users, particularly children and young adults, to continue experimenting and progress to regular tobacco use. Second, in the United States, a larger proportion of cigarette smokers who are African American use menthol cigarette brands. In fact, African American smokers are more likely than smokers from other racial and ethnic groups to try a menthol cigarette as their first cigarette. The proposal will advance health equity by reducing mortality due to tobacco-related disease such as heart disease, stroke, and hypertension, which is higher among African Americans compared to other racial and ethnic groups. And as I said before, let's not forget, the tobacco industry has specifically targeted the African American community with menthol cigarette marketing. And lastly, the proposal is going to save lives. And it's going to save lives by preventing the next generation of smokers and helping to increase the number of smokers who are actually able to quit. As I mentioned earlier, menthol flavoring is more attractive to kids and younger adults. And if menthol flavored cigarettes are eliminated, we are eliminating a gateway to a lifelong addiction of cigarettes. And as the FDA developed its proposal, it reviewed studies and scientific evidence. And one of the things that it found is that people who smoked menthol cigarettes found it much harder to quit. To summarize, eliminating menthol flavored cigarettes has the potential to eliminate a significant risk factor for cardiovascular disease. And in doing so, there's an opportunity to improve health equity and reduce the death and disease from smoking. So I'm going to turn the presentation back over to Megan, and she's going to walk through how you can take action in support of this proposal. If we want the FDA to finalize this proposal, then we're going to need to raise our voices in support of the proposal to eliminate menthol cigarettes. Megan, back to you.
Thanks, Camille. Okay, so let's go back to the principles of being an effective advocate and talk about what we're trying how these apply to this very specific issue. So just to run through them again, understand what you're trying to accomplish, understand your audience, show that you're a constituent and that you have interest standing in the issue, deliver a concise message, stay on message, don't use jargon, and make it personal. So looking at the first one. So if we think about ABC's mission statement, promote the prevention and treatment of cardiovascular disease, including strokes, in Blacks and other minorities, and to achieve health equity for all through the elimination of disparities. So we know that, sorry, that didn't quite work. We know that this issue hits all of those issues, hits all of those points. So we know smoking is bad, but menthol is a whole lot worse. Tobacco use, Camille said, tobacco use is a major contributor to 3 leading causes of death among African Americans: heart disease, cancer, and stroke. Menthol cigarettes are more harmful than regular cigarettes because menthol is thought to make harmful chemicals more easily absorbed in the body. So menthol makes it easier to inhale cigarette smoke. And some research shows that menthol cigarettes may be more addictive than non-menthol cigarettes. So the marketing has worked. The tobacco companies have launched this marketing campaign for decades, and it has worked, and it is deadly. The marketing of menthol cigarettes has been specifically targeted to African Americans. African American smokers are more likely than smokers from other racial and ethnic groups to try a menthol cigarette as their first cigarette. Over 7 out of 10 African American youths use menthol cigarettes. Used to smoke. And African American adults have the highest percentage of menthol cigarette use. Among those who use menthol cigarettes, mortality due to tobacco-related disease is higher among African Americans than compared to other racial and ethnic groups. So there is no question that we have standing in this issue and that this issue matters to our mission. So we now need to make sure that the FDA hears us on it. So we know that eliminating menthol cigarettes will reduce the number of African American youth who start smoking, advance health equity by reducing African American mortality, and save lives. So this definitely fits within our mission. And as community health advocates, we really want to make sure that this is something that we as a community are advocating for and standing strong on and saying this is something that makes sense and that is going to make a difference. So understand your audience. So in this case, we're talking to the FDA. So we will be writing comments that will be read by staff people at the Food and Drug Administration. They are actually required to read each and every comment that comes in. And then they log how many people were for it, how many people were against it, what changes were suggested. They pull good stories here and there to make sure that the lead administrators understand what the impact of this is. So we also want to show that we're a constituent and that we have interest standing in the issue. So again, you want to talk about where you live. You want to talk about who you are and what makes this issue something that you care about. In terms of delivering a concise message, we have a very concise message. Eliminate menthol cigarettes. Pure and simple. So that is about as simple and concise as we can get. We're going to stay on message. So we're not going to use our comments to the FDA to talk about drug prices, although that is also a very important issue. We're not going to talk about baby formula for those of you who may be dealing with that issue. Again, another very important issue, but that's not what we're focused on with this. And we're not going to talk about other tobacco issues with this. We're just going to stay focused on our one issue, our one request for the FDA for this point. We're not going to use jargon. So again, jargon is things that, special words or expressions that you may understand as part of your everyday life, but someone else may not who doesn't live that same life. And we're going to make it personal. So I want to give you an example of what I mean by making it personal. So I went ahead and wrote my own comments to the FDA on this issue. And I want to read you my intro for how I made it personal. So my name is Megan Gordon Don, and I live in Maryland. As a mother of two young boys who love candy and as a former smoker who is trying to educate my children about the negative impact that smoking can have on your health and life, I'm writing to support the FDA's proposed ban on the manufacturing, distribution, and sale of menthol cigarettes. Let's see, I was authentic. I am indeed a former smoker, although I had quit a long, long time ago. I started smoking in high school. My first cigarette was menthol. I remember thinking that it tasted kind of like a peppermint, and I got hooked easily and quickly. I smoked until I graduated from college. At first, I didn't notice any ill effects, but by my sophomore, junior year of college, I noticed that I got winded more quickly and had more and more trouble ignoring my body's call for cigarettes. It was hard to quit, very hard, but I did it. I hope that my children will never have to battle any addiction demons for any substance. I support FDA's proposed ban on menthol cigarettes because I believe that it's important that we not stack the deck against their generation. Let's remove the on-ramps like menthol flavoring that makes cigarettes and cigars more enticing to our youth. And then I go on to some of the other talking points that we will send you and that we're talking about as part of this presentation. So you get a sense of it is okay to be very personal in this and talk about how these issues really affect you. And you do want to be specific with where you live and pinpoint your geography. Sorry. So now let's move on to how exactly you would submit comments. So we're going to send this to you in an email with the website and a review of exactly how you fill this out and all the talking points that we've talked about in this presentation and reminders for how to do it. But first, you do go to a specific website. You're going to click on this blue comment button. And for those of you who want to, you're welcome to do this right now as we're talking. Oops. So then it'll take you to the write a comment section. And you put in, you see where it says my name is Megan Gordon Don. You put in your comment and you have up to, I believe, 5,500 characters. So my entire statement took just over 2,000 characters. So there's a lot of room. So you don't have to worry about running out of space. The counter will tell you if you're getting close. It'll actually tell you how many characters you've used so far. So you can look at that. You can also write your comments in a Word document and then cut and paste them into this comment website if you want. That's how I did it. And then it asks you to indicate what your comment is about. And that's just that you're an individual commenter. You're not a government employee. You're not kind of some other things. You're an individual commenter. You can attach files. So if you have a picture that you wanted to share with the regulators, you could. It's going to ask you for your email address. I would encourage you to opt in to receive email confirmation. because that'll give you a tracking number that you then can use for other communications. And then you're going to select that you're an individual. So you're not submitting these comments on behalf of ABC. You're submitting them on your behalf. And I would encourage you not to submit them as an anonymous commenter unless you're sharing anything that you would not want public, because these comments are public, and someone could find them. But again, nothing that we're saying as part of this is something that it's all important information to share. We want to stand up and have ourselves counted on this issue. So then it'll ask you to put in your contact information and say that you're not a robot. And then you submit your comment. So once you write your statement, that's the hard part. Actually filling out this form takes less than 2 minutes. And writing your statement does not have to be long and drawn out. You can make it just a few sentences. You can make it as long as you want. So once you submit it, you will get a screen that says you submitted it successfully, and you'll get a tracking number for your comments so that you can go back in and look at it and look at what happens. So the deadline for this is August 2nd. I know the screen that I showed a minute ago said that the deadline was at 17 days. They just upped the deadline on this. So that's great that it gives us all more time. But I would encourage you to actually do this sooner rather than later. We all know that we all get busy, and so do it now before this slides down on your to-do list. So next steps after this training. We will send you out an email with all the specific steps and the talking points that we talked to. All we're asking you to do is follow those steps and submit your comments by August 2nd. And use your experience as community health advocates to please ask others in your community to join you. The email is something that you can forward on to anyone you want. And so the more people that we can get involved in this, the better. And please look for other opportunities to join ABC in advocacy. This is just our first step. We really want to get involved in advocacy, and we want all of you involved in advocacy with a big A and a little a, so that together we truly can make a difference. So with that, I want to turn it over to Dr. Ferdinand, who's going to talk a little bit more.
Thank you, Megan and Camille, for sharing principles of advocacy to improve the health of our community. I want everybody to remember to put your questions for Megan and Camille in the Q&A box. We have a call to action for all of you attending this training. First, as Megan discussed, we are asking you to put this training into practice by sending your comments to the Food and Drug Administration in support of their proposal to end the sale of menthol cigarettes. Advocating in support of this proposal is so important to improving the cardiovascular health of our communities. Second, as ABC community health advocates, we would like you to do the following at the conclusion of this training. Complete the tobacco call to action by August the 2nd, described in the presentation. We have a little bit more time to get that done. Use your position as advocates to encourage family, friends, co-workers, and your community networks to get others to support this ban on menthol tobacco products. Getting this ban will help to maintain a heart-healthy community. Let's get everybody involved. Also, continue to put this advocacy training to use. Be on alert and be ready to respond to future ABC calls to action. We want to hear from you. Was this training helpful? You will receive a survey to complete that will inform us on how to improve future advocacy trainings, because there's more to come. Also, we all can take what we have learned today about advocacy with a big A and apply it within our communities at the local level and even at the state level. Now I'm ready to take some questions for Megan and Camille. You all can also raise your hand, and Alan will acknowledge you to open up your mic if you want to have a discussion with Megan and Camille with your questions. I'll start with the first one. Megan, this is an election year. Lawmakers and candidates will be coming to our communities asking for our votes. Do you have any suggestions on how our community can capitalize on this being an election year, and as well as some opportunities for engagement?
Absolutely. Thank you, Dr. Ferdinand. So this is an election year, and members of Congress and elected officials at all levels care about constituents because they want to hear what matters to you, but also because they want to know what matters to you so they know if they can do something to get your vote. And so one, it's really important if you see an elected official at an official event, whether it is a community gathering of some sort, or even at the grocery store, it is okay to approach an elected official and talk to them about the issue that you want to talk to them about. And identify yourself as a member of the community so they know that you're a constituent. But that's a good thing. And it really, election year is a great time to make sure that your elected officials are hearing from you. They care all the time what people are thinking, but they seem to care a little bit more as we get closer and closer to election day.
Very good, thank you. We do have some questions in the Q&A box. This is the first one. Aren't menthol cigarettes supposed to be better than non-filtered cigarettes?
Okay, thank you, Dr. Ferdinand. I did put a response in the Q&A, but I do think it's important to bring this up that menthol cigarettes make all tobacco products worse. So it makes any of them more dangerous. I don't know if there was a trade-off between a filtered cigarette versus a menthol cigarette. I think they have equal harm. They both cool the tobacco to make you able to take in more of the toxins. And so I think to the point that Megan raised a little bit earlier in terms of being specific on an issue, that to look specifically toward the menthol, not necessarily tobacco overall in terms of what's better in terms of filtered or non-filtered, which they are all bad, but looking specifically at the impact of menthol, because that's what they're able to act on at this moment, not necessarily the filters, but the menthol, even menthol in filtered cigarettes or menthol in unfiltered cigarettes. That's the problem that we're facing now, that we have an opportunity to influence. But just to answer the question, I don't know if there's a comparison between people smoking menthol cigarettes versus those smoking unfiltered cigarettes, but the effects of tobacco overall are extremely very negative, and they certainly had a terrible impact on our community. And menthol in particular is placing our youth at risk. I think older people who smoked unfiltered cigarettes likely from the war and Pall Malls and things of that nature, they're a little bit older, but we're looking specifically at children, not specifically, but largely at children when they're starting to smoke. And the menthol has a very detrimental impact on our youth, not necessarily the non-filtered, but the menthol has a very detrimental impact on our youth. And that's what's tipping the balance moving forward to adulthood with disease.
Thank you, Dr. Underwood.
Oh,
Camille.
you're certainly very welcome.
Camille, I believe this is a question for you. Although you have answered it in the Q&A, I think it would be beneficial for all of the other attendees to hear your response. How do we find out what proposed bills and acts are available for comment?
Yeah, that's a great question. And there was another one of our participants who was asking about a very specific issue, sleep apnea, and who the target audience would be. So you can comment on any piece of legislation that has been introduced in the U.S. Congress or in your state legislature. You comment by reaching out to the individuals who are your elected representatives. So if we're talking about the U.S. Congress, we're talking about 2 senators and 1 representative. And if you don't know who your senators or your representatives are, you can go to senate.gov or you can go to house.gov. And at house.gov, you just put your zip code in and it will pull up who your representative is. And you can, usually from their website, there will be a button for you to comment on anything you want to comment about. So any piece of legislation that you may read about in the newspaper, or maybe it's just an issue and there's not a specific piece of legislation, you should feel free to reach out to your members of Congress, either by calling their office or sending them an email, or if you're active on social media, you could ask them a question over Twitter or over Facebook. As it pertains to proposals like the one that we're asking you to comment on with the FDA, unless you're following it really closely, it's not always, there's not always, unless like ABC sends out an alert, there's not going to be maybe a lot of information out there about maybe some of the proposals that the departments or agencies of the administration have pending for comment. So that's where ABC comes into play. This is just our first step in helping you be better advocates for issues that are important to our community and to improving cardiovascular health. And so when issues come up in the future, our plan is to reach out to you because you have been trained and you understand the importance of advocacy. And we will ask you to take action. And we will give you the tools and the steps to take action. And in fact, after today's webinar, we are going to send you an email. And included in that email is going to be the call to action on contacting the FDA regarding the proposal to eliminate menthol cigarettes. And it's going to include talking points, and it's going to include all the steps that Megan went through. So you can do it at home, and you can share it with your friends and your family and members of your community, and also ask them to take action.
Very good. Camille, I believe we have another question here that you have answered, and it would be nice if you can share it with the audience. I advocate for heart health by way of obstructive sleep apnea awareness. Who would my target audience be if my area of advocacy does not involve the FDA?
Yeah, that's a great question. So it builds on what I was just saying. So if, let's say you're interested in the issue of sleep apnea and you want to know if there are any pieces of legislation that are currently introduced in Congress pertaining to that issue. So you can go to congress.gov, and it's a really easy tool to use. You just put in a search term, and it will pull up legislation that is relevant to that issue, right? As long as it has the word sleep apnea in it. You just have to make sure that, we're talking about legislation that's current and it, wasn't introduced 10 years ago. But you can look you can search using that tool for legislation that you might be interested in by topic area. And if you find something that you support, or perhaps you find something that you object to, then you can contact your members of Congress about that piece of legislation. Now, you are all asking great questions, and in fact, you're asking questions that are 2, 3, and 4 steps ahead of the training that we've done today, and that's fantastic because you guys are really thinking about this. Which says a lot about the community and your interest in being effective advocates. So we really look forward to future advocacy trainings with you all, so you can build on what you've learned today and be able to tailor and personalize your advocacy to issues that are really important to you and people in your community.
Thank you very much, Camille. I think that these are trained advocates, actually. So we have trained them, and that might be why you feel like they're a couple of steps ahead of what the typical training is. But I will also say that for looking at some of these issues, just as you said about sleep apnea, something now that's a hot topic, and again, I know we want to stay on topic with menthol, but just for the process, it's the reimbursement for telemedicine, which is very important for sleep specialists as they monitor their patients. And there's a lot of interest in terms of being able to continue the reimbursement for telemedicine so that these are actually legitimate visits that your insurance would pay for moving forward outside of the pandemic. And so there's a lot of concern about how this is coming about. And it's not only directed at sleep apnea, but certainly sleep physicians do see this as a particular obstacle to their practice. And so to join advocacy efforts that may help to influence decisions on whether to continue telehealth or not after the pandemic are issues that may be current that would impact sleep medicine that you may be able to align with if there's not anything, as Camille said, that's recent in terms of legislative policy decisions being made around sleep apnea and sleep medicine. So and that's what ABC does a lot of, is looking at actions that have impact on heart health. And the community is very broad. There are many issues that can relate to an individual's heart health, but when Camille mentioned that the policy alert, when ABC looks at something and gets behind some of these issues, we want people to know so we can have a collective effort against them or for them, whatever the position is. Just they may not affect the heart only, but certainly we feel that it's enough of an impact on heart health that we need to alert our network to respond to it.
Very good, Dr. Underwood. Camille or Megan, this can be for either one of you. I have this question. Legislators are not always knowledgeable about health issues that impact their constituents. We all know that. How would one go about approaching them to inform them of issues or situations that negatively impact the health of their constituents? How do we develop or cultivate these relationships with our legislators?
So members of Congress in particular are home at specific times throughout the year. So they're going to be home for the July 4th recess over the week of July 4th. They're going to be home mostly for the month of August. And they all have district offices. So you can go on your members of Congress, your 2 senators, your representative, and look at their location of their offices and find the office that's closest to you. They'll have a Washington, D.C. office and then offices back in the state. And you call the office and you make an appointment. And you will most likely talk with a staff member. And one of the things that's important to remember is that staff members are really important. And so educating the staff member about the issue is oftentimes a great first step in building that relationship with that office. And you can make an appointment to educate the staff member about that issue. And then you send an email a little bit later and follow up with them, see if they have any questions. Maybe you dropped off a pamphlet that talks about ABC's services in the area. So you can give them extras of those pamphlets to give to constituents, see if they need more. That's another opportunity. And so you start there and you build the relationship, and then you can, you just build it from there. And it's really like building a relationship with anyone, with your doctor's office, with a teacher. You just have to start the first step and keep it. And the secret is really keeping it going.
Good.
I have a question along the same lines, though, if you don't mind me interjecting again. So what is the most compelling type of fact that one can lead to their constituent, their legislator, to help propel our influence further? I mean, so we have to give them compelling information. You mentioned earlier, like where, who I am and where I'm from. But in terms of the disease, how it's affected me or my community, what are the compelling facts that they use to help say yay or nay when it comes to time to vote?
So number one, personal stories. So talking about how a heart health issue has impacted you, and then talking about how it's impacting the community. So this is how it's impacted me. I know 10 other people from my church that have had this same exact thing happen to them. And this is our community. This is, we need to address this for our community. Statistics are helpful, but they're more helpful when you're talking, if you have statistics for your community or for your state. And oftentimes it's really easy to get bogged down in the statistics. And so a member of Congress can always, if they want a statistic, they'll ask for it. And that's always good information to have. But I would lead with your personal story and or stories of others in the community that you can share to show that this is a real issue impacting real people.
Thanks.
So Megan, with that, how often should we approach these legislators or these lawmakers? How often should we be, sending information or the petitions? Is enough? Tell us how many times are we supposed to be communicating with them about these issues?
I think it depends whether or not you have a specific issue that you want action on, or if you're trying to build up a relationship with the office. So we are all busy individuals in this day and age, right? And so you never want to just make it one meeting and then you never talk to that person again. But you also don't want to pester and keep calling if you don't really have anything new to share. And if you don't have a specific thing that you're asking them to do, oftentimes congressional staff will appreciate one meeting of kind of general education, but they don't really appreciate multiple meetings of general education unless there's something specific that you want them to do, because they have just to give you a sense, a U.S. representative's office is typically representing 700,000 people. And not all those people, actually very few of those people, contact the offices and ask for a meeting. But it is not unusual for congressional staff or district staff to have 10, 15, 20 meetings a day. That every 15 minutes can be scheduled. Okay. And often is. So just keep that in mind of, if you have new information to share or you have something specific you want them to do, that's a great opportunity.
Okay. We have an anonymous attendee that submitted a question, and I think, Megan, this one was for you. I think it's related to how we actually make comments using other mediums to communicate the issue, to the audience. So when submitting our comments, should we also share what we've made a comment about this topic, or share that specific comment that we made on social media? And if yes, what would you recommend? First, we just share with our network to encourage them to do the same, or do we share our comment by tagging our representatives? Is there a social media platform we should use over others?
That's a great question. And social media is a fantastic tool to encourage other people to get involved and to make sure that your elected officials are clued into what's happening. So first, I would say that to get others to get involved, both Twitter and Facebook are great avenues for that. And particularly, letting someone know if you have the link to the website for the comments, you can say something on either Facebook or Twitter or both, that you took action on this, you did this, it only took you a little bit of time. It would be so helpful if others also use their voice to contribute to this. And then you give them the website and encourage them to do that. You can, when on Twitter, if you're trying to alert an elected official to an issue, Twitter is really the best avenue for that. You can tag a member of Congress. So I would say, if for the purposes of these comments, what we're asking for right now, I would probably focus on either Facebook or Twitter to ask others in your community to get involved. You might want to tag your members of Congress to let them know that this issue is important to you, but I would focus on getting others involved. Because right now, the law has already been passed, so there's not something that we need Congress to do right now on this. We need the FDA to take action, and that's different than Congress. And FDA isn't necessarily going to put as much weight on being tagged in a tweet as they will through the official comments for the purposes of this.
We're asking our advocates to get involved with these campaigns and these health issues that are affecting our community, and making these networks with family, friends, and communities. I know how important it is to keep the momentum going with engaging supporters in our communities. How do we build real lasting relationships with our supporters to achieve some memorable change that could impact policy? Any one of you all?
That is a great question, and something that we should do a whole lot more discussions on, because there's a lot to that. All of this is focused on relationship building, right? And it's all, the more that you can keep people informed and give them specific things that you're asking for their help at appropriate times, the better that relationship is. And, you want to be thinking through, not just sending out something every other day, but sending something that's really going to make a difference. And so depending on what kind of communities you have, what types of groups you have that you work with, there's a variety of tools you can use, from occasional emails to monthly meetings. And it's really kind of looking at a menu of options and deciding what works best for you.
Thanks,
Do we have any more questions? Oh, Camille, you have some comments you'd like to make?
Yeah.
Great.
Yeah, I was going to say, it's really great to follow along what your elected officials are doing. So you can go onto their website and you can sign up for their newsletter. And you'll get their, some of them mail them out, a lot of them email them out. But you can follow along what your members of Congress are working on, and you can send them an email or write them a letter and share your views on issues that they may be actively engaged in. And another thing is, Megan was just talking about the fact that lawmakers are going to be home in July and they're going to be home most of August, and there's going to be opportunities for you to run into them, whether it's at a 4th of July parade or maybe it's your county fair. But it's an election year, right? And lawmakers and candidates are going to be looking for volunteers. They're going to be looking for people going to go door to door and hand out pamphlets, or they're going to be looking for opportunities to come speak at your community event or at your church. And that is a really great way to work at developing a relationship either with an elected official who's seeking re-election or with a candidate who may find themselves elected to office. And these members of Congress, remember, people, like when you interact with someone, think about creating a lasting impression, and telling them where you live, what's important to you, and making sure that you make yourself known to the staff who is traveling with that elected official or the person who's running for office. So there are opportunities to engage this year and to really develop relationships. And it doesn't have to start when that member of Congress gets elected. It can happen way before November. And so I would encourage you, if you're inclined that way, to look for those types of opportunities.
Great. We have more time left for the audience to ask more questions. I would like for you all to share with us, how do you feel about this menthol cigarette campaign of supporting the FDA proposal? Can we open up the mics and the audience? Can you share with us your thoughts and give us any comments about how you feel about this campaign that the ABC is partnering with you? All you have to do is raise your hand and Alan will open the mic for you to ask your questions and we can have an open discussion. Miss Marlene, Miss Helen?
It looks like there's a question from Cheryl Brickley.
Okay.
It's not a question. Good evening to you all. I just want to say that it's very good for us to contact Congress and our elective officials. I just want to tell you that I do have a story about the menthol cigarettes. So it would be an honor for me to contact them and let them know how dangerous it is, because I was a smoker for 20 years and I developed COPD. And 2/3 of my lungs is permanent damage. Mm-hmm. So, and I've also been intubated twice. So I know the danger of smoking these cigarettes. And it was menthol cigarettes that I was smoking for this amount of time. And the doctor will consider that that's not a very long time. Like he said, you don't have to smoke the cigarettes a very long time. It could be in a short period of time that you can develop these diseases. So I do have a story and I will contact them. And I know a few other people that has the same story. So in order for them to eliminate these menthol cigarettes. I'm trying to get my daughter to stop smoking. Yes, they are addictive. It's hard for them to stop. I think what caused me to stop was because I was intubated. I was in ICU. My heart gave out. I mean, and that was a reason to really stop. But you don't want to wait until you get to that point to try to think about stopping. So it is addictive. And what I'm confused with, why is it that so many health disease attack the African American community? Because when we talk about the heart disease and diabetes, I don't want to bring all that up, but why is it that it attacks the African American community more than any other ethnic groups? That's what I'm really concerned about that. But anyway, I'm really appreciative of being on this training, and I will write that letter and get those that I know to do the same, because it needs to be eliminated, those menthol, and to really tell the truth, they all need to be eliminated, the cigarettes completely, but the menthol, I see, so I had a comment. I didn't have a question because I've experienced all of this.
Ms. Cheryl, thank you so much for sharing your story and those comments. They are so very, very important for us to hear that. Dr. Underwood, did you want to, make any comments regarding the question Ms. Cheryl had?
Sure. Her
About
comment,
the impact of the African-American community?
I agree with her 100%. And certainly I think that story is extremely compelling when you see the influence on your children, as you said, your daughter, and the same influence that's there, the impact. I think that the inequities that are facing African Americans have been present for some time. And I think that Juneteenth, this time that we're in at this day, is a very important point to bring up, that some of these things have been left behind and they have been left to prey in the African American community over a period of years. This has been a source of revenue. People, buying cigarettes and smoking them is definitely a source of revenue for tobacco companies. And if you can secure a market, such as by using menthol cigarettes, that you can continue selling these things, despite what happens to the people who use your product, that they may become ill and die, certainly may die prematurely, is not the issue. It's just a matter of being able to sell these things, and you have a group of people that can buy it. And that type of marketing has taken place in the United States, particularly as it relates to African Americans, for many, many, many years. And we are here now trying to organize people to stop it. To, what can we do to make our community safe so that your children don't have the same influences that you had when you were growing up that may have been a deterrent to your achieving optimal health. And that's exactly why we're gathered around. That's why the Association of Black Cardiologists thinks that it's very important for us to rally around this issue in particular. And when it's important enough that our committees work together between our community programs committee and our advocacy committee to get this training, to try to help see what we can do to strengthen our position to stop this now.
Thank you.
And thank you, Ms. Cheryl. Thank you so much. Mm-hmm. And I'm hoping that we have some advocates from the Mississippi Delta who are also working on a campaign to stop smoking and fighting against tobacco. And if we do, we'd like to hear from them as well as to how they feel they would be able to, support this campaign and support this FDA proposal to stop menthol cigarettes in our communities.
Dr. Ferdinand.
Yes, ma'am.
Oh, this is Roylene in New Orleans. And I did have, I'm sorry I had to interrupt before the Mississippi chat.
No, that's quite all right, Roylene.
Okay, but we just finished our With Every Heartbeat is Life section on smoking just last week. And it was just a really good, feedback from my class, where one lady talked about secondhand smoke and how it has affected her with cancer. So it was, interesting that the class really was interactive and talking about things. And we found out that in one of our parishes here in Louisiana, Jefferson Parish, they have lifted the smoking ban. And so in restaurants and stuff, you can still smoke. And that
wow.
we really didn't know that. So, this, I think this will help with maybe getting some action in Jefferson Parish on, putting that smoking ban back in effect in restaurants, because everybody, when the secondhand smoke comes, it affects everybody. So
Absolutely.
yeah, so
Absolutely.
I just want to comment on that.
Thank you, Rolene. Thank you for that. Yes, we are hoping that this petition against menthol cigarettes will possibly spur some other advocacy work and activity in other areas as well. But now we are focused on trying to get this one accomplished. But
I have
let me know.
another thing. So also from,
Go ahead,
like you said,
Paul.
Dr. Ferdinand, from the Mississippi Delta group, where we know that amputations are so important. There are oftentimes cigarettes associated with that process of vascular disease and amputations. And so I think it's definitely essential that we eliminate tobacco from those communities. And again, menthol is often how communities are inoculated with this tobacco that causes harm in the future. I'm sorry to interrupt.
And
No, go right ahead,
and
Camille.
Dr. Ferdinand, I just want to jump in. Rolene, you mentioned that it seems like some of the smoking restrictions have been lifted in public places in your community, and so you have the tools through previous trainings that you've done and today's training, where you can actually take your advocacy to your local and community level and voice your disagreement and displeasure with any decisions that have been made that would put the public or people who work in those places, businesses, at risk. And so, as Megan talked about, and we're all talking about, is that advocating at the federal level is just one avenue for advocacy. But take what you've learned today, and you can apply that at the community and local level or the state level. It doesn't just have to be the federal level.
Thank you.
Anyone else in the audience would like to share their work in advocacy, especially in the area of tobacco? If we do, Dr. Ivy, maybe you can let us know if we have any members from the Delta that are attending this training, and so that they can share with us the work that they have been doing in educating their community around tobacco.
And we do have quite a few participants from the Mississippi Delta region. I don't want to call out any particular participant, but please feel free if there are any participants from the Mississippi Delta that would like to share. Looks like, Alan, you have your hand raised.
Well, we look forward to
Hello?
working with them. Is there somebody came on? Did somebody come on?
Hello? Oh yeah, am I unmuted? This is Helen.
We hear you, Helen. Go right ahead.
Oh, okay. I don't have a story to share necessarily, but just something I wanted to add about regarding advocacy outside of contacting legislators and whatnot. I have been asked, and I have been participating in city and state working groups, I guess. So like right now I am in a working group with the New Orleans Community Health Improvement Plan and with the Louisiana State Health Improvement Plan. And so getting on to working groups and boards and organizations that are doing citywide or statewide improvements, health improvements, I think is another way to advocate for the needs of your community, because you're part of now this larger organization that's going to work towards improving health.
Oh, thank you, Helen. Ms. Shawana Holmes, would you like to speak and share?
I would, thank you. Can you hear me?
Yes, ma'am, we can.
Okay. Yes, I'm Shauna Holmes. My area of advocacy is heart health. And I promote heart health in any way that I can, but especially in the area of treatment of obstructive sleep apnea. And the reason why I'm so passionate about that, and any heart health, but the reason why I'm so passionate about obstructive sleep apnea is because there is no formal training, medical training of any kind that really delves into how obstructive sleep apnea affects the heart. So one of the things that I tell my patients is that, untreated sleep apnea actually increases the likelihood of the development of congestive heart failure by 140%. Sleep apnea, obstructive sleep apnea actually increases the likelihood of all-cause morbidity. And so a lot of patients that I see generally have the same diagnoses. And it's not that the diagnoses are incorrect, it's that the root cause is missed, or that it's not apparent that there's an underlying issue. So, if a patient is smoking, I explain to them how smoking can affect their heart and how it's actually the effects of the smoking are being exacerbated by the untreated sleep apnea. So that's kind of what I do. So, just so many of the patients that I see have been dealing with their sleep apnea issues for decades. Just to give you an example, I met a patient the other day who his wife had come in. The patient himself wasn't coming to be seen, but in talking to the patient and explaining to them what was going on with them, we found out that the husband actually had a history of resistant hypertension, to where he ended up having to get a kidney transplant. When he was getting his workup for the transplant, he was found to need a bypass, and then had to get a defibrillator implanted. But he's never been offered a sleep study. My father has peripheral artery disease. He has had all of his toes amputated. Oh. He has snored as far back as I can remember. And he has a BMI of over 30. Being a male is a risk factor. And he's never been offered a sleep study. My mother has resistant hypertension. She doesn't eat anything out of a can or a box. And she is 5'8", 160 pounds. And my mother has insomnia. Those are being postmenopausal is also a risk factor. I think a lot of clinicians just aren't aware of how to recognize it, so it gets missed a lot at the bedside. Even in hospitals, even when I used to work med-surg years ago, I would see individuals who were maybe, say, when they were desatting at night, and or their oxygen was dropping at night. Sorry, I don't know if everybody here is clinical, but if their oxygen was dropping at night, what we would do was adjust the parameters and put them on oxygen. And then we would send them home on nocturnal O2 and never address the possibility of OSA. And so when we see them again, they have far advanced, they either have developed AFib, they have far advanced CHF. And I think that a lot of people just have not been educated on the fact that untreated sleep apnea is causing sympathetic overactivation, which leads to a whole bunch of other things. So that's kind of where I advocate. I am about heart health in any way, shape, or form, but sometimes it's not easily received from me because I'm not a physician. I am I'm a sleep technologist and I'm certified in clinical sleep health. So, and I'm licensed by the Board of Medicine here in Virginia. But I think there's a lot of attention to my position in medical hierarchy. So it's not as easily received. So I do actually have a physician that is backing me now. She's a neurologist in sleep. So,
Well,
But
we
I think
really,
it's fantastic, but we do have a member within ABC who is very interested in sleep and certain
Okay.
heart disease as well. And I think it would be nice to have a liaison. I think that there's a group of cardiologists that are interested in sleep medicine. And it's this
Absolutely.
type of communication and advocacy that we're speaking of here in terms of grassroots to be able to raise issues. So we certainly have your information, and I can try to make some introductions to connect you with another group that that has ABC members that is very interested in the interaction between sleep and cardiovascular disease.
Absolutely.
So this is fantastic. Thank you very, very much.
Thank
and
you.
Ms. Holmes, why don't you put your information in the chat for us?
Okay.
Okay, we appreciate your comments. Thank you very much.
Thank you.
Thank you.
We have time for just one more question. I want to thank you all very much for the discussion. It's been very enriching and purposeful. Roylene, I believe you wanted to ask a question.
I put it in the chat. I mean, in the question and answer, but I could just say it.
Yes.
My question was, will ABC provide us with talking points and other information that we could provide in the community and to our elected officials? And is there a PSA, or are we just now just placing comments in the regulations.gov? And I said, I'm asking this so that we'll all be on the same message. We'll be on the same, talking message.
Yeah. And I believe Camille responded to you. We will be, you want me to, Camille, would you like to respond since you already done it in the Q&A?
Sure, I can. We have an alert that we'll be sending to everyone who participated. All of our community health advocates will get a call to action. And so it'll include some talking points. It'll include some prompts for you to tell your story. And it will also include the steps that Megan walked through for accessing the online portal for submitting your comments. So do look for that. And then you should feel free to forward that or make copies and give them to your friends or your family, whatever, please spread it widely.
Right. And am I correct to say that the presentation slides that we use today, those will be available for our coordinators as well?
Great.
Okay, because the presentation from Megan, if I can say so myself, was just really on point and very, very targeted for this important issue for all of us. And I think that this is fantastic to be able to use a real problem in real time to organize us to be able to have more impact and what is most concerning to us.
Yeah, I think Alan said that the recording will be live by around Thursday.
Mm-hmm.
We'll make sure we send everyone a link.
Okay. All right. We have about 1 minute left. And I would like for either Megan or Camille to make just maybe a short, brief statement, closing statement, leaving some important pearls for people to follow regarding their presentations and this proposal for supporting the FDA to stomp out menthol cigarettes.
So I'll just start and then maybe Camille has a few words as well. I mean, this is such a phenomenal opportunity to make our voices heard and make a difference. And so please use this opportunity and get everyone that you know. And let's take down the FDA website with lots and lots of comments.
Camille?
Yeah. I spent a little bit of time the other day going through some of the comments that had already been posted to the site on the menthol proposed rule. And there were a number of comments of people opposing it. And so we are at risk unless advocates who support eliminating menthol cigarettes of not having this proposal finalized. And so it's really important that those who are committed to helping to improve heart health in their communities and among their friends and their family really take a moment to not only take action yourself, but to encourage others to do so as well. So we have an incredible outpouring of support for this proposal. So thank you all so very much for taking the time this evening to listen to this presentation and to advance your advocacy, knowledge, and wisdom.
On behalf of the Association of Black Cardiologists, I want to thank each and every one of you for attending this advocacy training program. We expect to have more to come to share with you. Thank you, Dr. Underwood. Thank you, Camille and Megan. And thank all of you all again for attending this webinar. Happy Juneteenth.